Good morning. In yesterday's class, we discussed the pharmacology of aminoglycoside antibiotics like gentamicin, streptomycin, their mechanism of action, uses and adverse effects. In today's class, we will be discussing the pharmacology of the quinolones and more specifically the fluoroquinolone antibiotics, or better still, antimicrobial agents. In the 1960s, the synthetic quinolones were developed, of which nalidixic acid was the first to be used clinically. Now, nalidixic acid is effective against gram-negative organisms like E. coli, Proteus, Klebsiella, and some Enterobacter species. On oral administration, nalidixic acid is absorbed almost completely and excreted with very high concentrations in urine. And so today, nalidixic acid, if at all used, is used mainly for urinary tract infections caused by E. coli, Proteus, Klebsiella, and for treating diarrhea caused by these organisms. The problem with nalidixic acid is resistance develops very quickly. So as of today, nalidixic acid is not routinely used. So to overcome this problem of rapid urinary elimination and reduce the risk or chances of resistance developing, to the quinolone molecule, fluorine was added, which resulted in what we call today the fluoroquinolones. So fluoroquinolones are quinolone with one or more than one fluorine atom added to it. The fluoroquinolones are classified based on their spectrum of activity. The first generation includes synoxacin and nalidixic acid, which are effective mainly against gram-negative organisms. The second generation fluoroquinolones include lomefloxacin, ciprofloxacin, norfloxacin, enoxacin, and ofloxacin. Now, ciprofloxacin is one of the most widely used antimicrobial agents today. So the second generation fluoroquinolones are effective against gram-negative organisms like E. coli, Klebsiella, Proteus, including Pseudomonas, and a few gram-positive organisms like Staphylococcus aureus. The third generation fluoroquinolones, which includes levofloxacin, sparfloxacin, gatifloxacin, and moxifloxacin, in addition to being effective against gram-negative organisms like the second generation, they have some amount of expanded gram-positive coverage. Please notice the first three generations of fluoroquinolones do not have any activity against anaerobes. The fourth generation, trovafloxacin, has broad anaerobic coverage. So going down from first generation, effective against gram-negative, second generation, gram-negative plus a few gram-positives, third generation, gram-negative plus expanded gram-positive coverage, fourth generation has broad anaerobic coverage. Coming to the mechanism of action of fluoroquinolones. The fluoroquinolones act on the bacterial DNA, whether the bacteria needs to produce RNA from DNA or DNA from DNA, that is whether it is transcription or replication. The bacterial DNA first has to unwind, and after unwinding replication or transcription, the DNA strand has to be resealed. These functions of unwinding and resealing is carried out by the enzymes DNA gyrase, also called topoisomerase 2 and topoisomerase 4. So the mechanism of action of the fluoroquinolones is they inhibit bacterial DNA gyrase, which is also called topoisomerase 2 and 4. Thus, strand cutting, supercoiling, and resealing is blocked. So there is no DNA replication nor there is transcription to produce RNA. So the fluoroquinolones are highly bactericidal. On oral administration, almost all the fluoroquinolones are well absorbed, penetrate most tissues and fluids except the CSF, that is the fluoroquinolones do not cross the blood-brain barrier, and they are mainly excreted in urine. Fluoroquinolones can also be given intravenously. The fluoroquinolones are not given intramuscular because the intramuscular injections are very painful. Now coming to the adverse effects of the fluoroquinolone antibiotics. On oral administration, they can cause nausea, vomiting, diarrhea, that is gastrointestinal upset. On the CNS, headache, dizziness, anxiety, motor incoordination, and in very rare circumstances, seizures. Allergic skin reactions in the form of rash, photosensitivity, and urticaria. Very important adverse effect of the fluoroquinolones is tendonitis and tendon rupture, especially in adults. So when a fluoroquinolone antimicrobial is prescribed for an adult, the patient should be very clearly instructed not to carry out any strenuous physical activity like lifting a bucket of water. Okay, there have been instances where the biceps tendon has ruptured. So this is an important instruction to be given to the patient, adult patient who has been prescribed a fluoroquinolone antibiotic. Fluoroquinolones are not used or they are contraindicated in children because the fluoroquinolones have been shown to cause cartilage damage and arthropathy in experimental young animals. Therefore, fluoroquinolones are contraindicated in children. Fluoroquinolones inhibit hepatic microsomal enzymes. So the other drugs which are metabolized by hepatic microsomal enzymes, their plasma levels, therefore the toxicity of those drugs can increase. Non-steroidal anti-inflammatory drugs enhance CNS toxicity of the fluoroquinolones. If fluoroquinolones are co-administered with antacids, the oral bioavailability of fluoroquinolones decreases. Another important adverse effect of the fluoroquinolones is they can cause cardiac dysrhythmias, especially in the form of prolongation of QT interval. So among the adverse effects of fluoroquinolones, the important ones one should know is tendonitis and tendon rupture in adults, arthropathy in children, and cardiac dysrhythmias, that is in the form of prolonged QT interval. Now coming to the uses of the fluoroquinolone antibiotics. Ciprofloxacin is widely used in the treatment of urinary tract infections, gonorrhea, bacterial gastroenteritis, typhoid, bone and soft tissue infections, and is a reserved drug in tuberculosis. The usual dose of ciprofloxacin is 500 milligrams 2 times a day. BID means this in die, that means 2 times a day by the oral route, per oral. Norfloxacin is almost exclusively used in the treatment of urinary tract infections. The usual dose is 400 milligrams per oral twice a day. Pefloxacin is used as an alternative to ciprofloxacin, so the uses are just like ciprofloxacin. That is, urinary tract infection, gonorrhea, bacterial gastroenteritis, typhoid, bone and soft tissue infections. Pefloxacin is also used in meningeal infections. The usual oral dose is 400 milligrams twice a day per oral. Ofloxacin is used for leprosy, ear, nose, throat and respiratory infections. Gatifloxacin is used in streptococcus pneumonia infections, chlamydia pneumonia infections. Usual dose is 400 milligrams once a day per oral. Sparfloxacin is used in pneumonia, chronic bronchitis, sinusitis, ear, nose, throat infections. Lomifloxacin is similar to ciprofloxacin with a longer half-life and is given once a day. Levofloxacin is used in chronic bronchitis, community-acquired pneumonia, pyelonephritis, sinusitis, and skin and soft tissue infections. Moxifloxacin is a reserved drug in tuberculosis and is used in treatment of urinary tract infections. Now, among the fluoroquinolones which we have mentioned, sparfloxacin and lomifloxacin and moxifloxacin may cause cardiac dysrhythmias, that is, prolongation of QT interval. So to quickly recapitulate, the quinolones are synthetic antimicrobial agents. Nalidixic acid was the first one to be developed, effective against gram-negative organisms. E. coli, Proteus, Klebsiella, used mainly for urinary tract infections and diarrhea because nalidixic acid achieves high concentrations in urine. So the fluoroquinolones are classified into first, second, third and fourth generation based on their spectrum of activity. First generation, gram-negative organisms. Second generation, gram-negative organisms including pseudomonas and few gram-positive organisms. Ciprofloxacin is a frequently asked 5-mark question. Third generation fluoroquinolones like levofloxacin, gatifloxacin have activity against gram-negative organisms with expanded gram-positive coverage. Fourth generation fluorofloxacin has broad anaerobic coverage. The mechanism of action of the fluoroquinolones is inhibition of bacterial topoisomerase 2 and 4. So, DNA replication and transcription to RNA both are inhibited, therefore fluoroquinolones are bactericidal. The pharmacokinetics, well absorbed on oral administration, does not cross blood-brain barrier, excreted unchanged in urine. Also given intravenous, intramuscular not given because injections are painful. Adverse effects, the things to remember are tendonitis and tendon rupture in adults, contraindicated in children because they cause cartilage damage and arthropathy, and cardiac dysrhythmias in the form of prolongation of QT interval. Coming to the uses, ciprofloxacin, almost the drug of choice for typhoid, also used in urinary tract infection, gonorrhea, gastroenteritis. Usual oral dose is 500 milligrams twice a day orally. Norfloxacin, reserved for urinary tract infection, 400 milligrams twice a day per oral. Pefloxacin as an alternative to ciprofloxacin, 400 milligrams per oral twice a day. Ofloxacin, reserved drug in leprosy. Gatifloxacin, especially for pneumonia, streptococcus pneumonia and chlamydia pneumonia infection, 400 milligrams once a day per oral. Levofloxacin for chronic bronchitis, community-acquired pneumonia, sinusitis, etc. Sparfloxacin, lomefloxacin, moxifloxacin. These are among the ones which are known to cause cardiac dysrhythmias. So fluoroquinolones can be a main question. Classify fluoroquinolone antibiotics, antimicrobials. Describe mechanism, uses, adverse effects of ciprofloxacin. 5-mark question, ciprofloxacin. 3-mark questions, give reason. Fluoroquinolones should not be used in children. The reason is they cause cartilage damage and arthropathy if it is used in children. Thank you.